Good morning to all. Today we will start with the new topic that is congenital anomalies of the female reproductive system. As we know that in the female reproductive system there are various organs they are included, that is uterus, vagina, cervix, fallopian tubes and ovaries. So this all that are combinedly will be covered under this topic, that is whole genital organs, there will abnormalities or congenital anomalies that we will discuss. The congenital anomalies of the female genital tract. They are mostly developed due to the developmental issues of that girl during their embryological period. Okay, embryology as that is a development of fetus inside the mother's womb. So if there is certain developmental issues at that time or during the development of the babies, the congenital anomalies of the female genital tract can develop. These formations it can occur, means the congenital anomalies it can occur either in the vagina, ovaries, uterus and the cervix. Next, some basic symptoms of the congenital anomalies. Okay? Because most of the patients or most of the girls with the congenital anomalies they are asymptomatic. They don't have any symptoms or they don't have any complaints due to the congenital anomalies, but sometimes they experience the symptoms that includes the inability to empty the bladder, means they are not able to completely empty the bladder, they are not able to pass the urine at properly. The breasts do not grow. The development of the breast, that is a changes of the girl's physical features at the time of the puberty. So if they are having any congenital anomalies, the breast development will not be there. The menstrual flow, that is a menarche is there that occurs despite the use of a tampons. Means there is a menstrual flow is there. Next, the women who are planning for a pregnancy or who have planned the pregnancy, they are having a repeated history of preterm birth. Preterm birth, that is the delivery of the baby before 37 completed weeks. And second one, that is a miscarriage or abortion. That is expulsion of the products of conception before the viability age. Monthly cramping or pain without the menstruation, means the cramp like pain or abdominal and pelvic pain is experienced by the girls without any menstruation. Next, pain with the intercourse, means during the time of intercourse they are feeling pain. So these are the common signs and symptoms which will come in the all of the abnormalities. I am repeating: inability to empty the bladder properly, the developments or enlargements of the breast do not grow properly, the menstrual flow despite the use of tampons, repeated preterm history or miscarriage history will be there. Women may experience a cramp-like pain or pain without the menstruation, and there will be a pain at the time of the intercourse. Next, that is causes. As we discussed that is due to developmental defects at the time of the embryological developments. So the development of the baby, it is a very complex process and there are several factors that can interrupt, while the exact cause is unknown, but there is issues in the developments. It may be related to the genetic defects or even the use of certain drugs during the pregnancy. Okay, that is known as the teratologic effects of the drug, because at the time of pregnancy the mothers they are not taking any medication without the prescription, because the medication can cross the barriers and they can affect or they can cause these types of anomalies in the babies, and that is under the teratologic effects of the drug. Some of these anomalies, it can affect the fertility and contribute to the pregnancy complications. Because of some anomalies that is related to vagina, cervix, ovaries and tubes, there are chances that the women will become infertile, and sometimes there are complications related to the pregnancy that are, as we have discussed, that there is a chance of the preterm birth of the babies, chances of abortion will be high. The doctor will educate the mothers on possible risk factors that are associated with the malformations. Okay, so there are the risk factors which can lead to this. The doctor will educate us regarding that. So this is the causes in summarize from this whole. The exact cause is unknown, and that is the developmental defects or genetic defects at the time of the pregnancy of the mothers, and second one due to the teratologic effects of the drug. That is the only cause of the congenital anomalies of the reproductive tract. Next, types. There are several types of congenital anomalies of the female reproductive tract, and that can occur, or the types they are divided or they are given according to the organs. The anomalies, they are in the vagina, in the ovaries, in the uterus or in the cervix. These malformations, they includes, first, we'll see about the congenital anomalies of the uterus. Okay. Uterus, we have already learned about the basic or normal anatomy and physiology of the female uterus. Okay. So remember that, and after remembering, start with the anomalies. A septate uterus. Septate means one division or one abnormal section is there. Okay. So a septate uterus, it's a common congenital uterine abnormalities, and this condition, it occurs when a band of muscles or tissues, they divide a uterus into two sections. Means the uterus is divided into two sections because of the presence of this septum, and this condition, it can cause miscarriage and preterm birth. Now try to remember what is miscarriage and what is preterm birth. Okay, miscarriage, that is abortion, that is uh, abortion, that is products of the conception, they are expelled out before the viability age, and preterm birth, that is the birth of the baby before completion of the 37 weeks. Next, there are subtypes of the septate uterus. That partial septate uterus and complete septate uterus. Okay. Partial means that is a half, and complete, a completely the section is there. The partial septate or subseptate, it involves the endometrial canal but not the cervix. And under the complete, if it's extend to either the internal os or the cervix, means here only the endometrium is divided under the partial septum, and in the complete there is a division of not only the endometrium but with the internal os and a cervix. The septum, it extends into the vagina, that is septate uterus and the vagina. Okay. Here the diagram, this is a diagram of the normal uterus. Okay. Here you can see that it is a whole globe like structure is there. Okay. And if the septate uterus is there, then this is a partial septate. In that, here you can see that the endometrial, that is a two divided, that is a partial septate, and complete means the whole endometrium and cervix, they both are divided in the two sections. Okay. So this is the uterine septate. The uterus is divided into two sections, two types, that is a partial and complete uterine septate. The symptoms: unusual pain before or during a menstruation, complications during the pregnancy and at the time of the delivery, that includes a preterm labor and miscarriage. And second one, that is a breech delivery. Breech, As if you have seen the delivery of the baby, then the first part in the normal delivery, that is the head of the baby. The head will deliver first, and then the rest of the baby's part, that is the shoulder, neck, and trunk, will be delivered. But under the breech delivery, there is a delivery of the feet will be first. Means the baby's leg will deliver first, then baby's trunk and head is delivered. Okay, so that is known as the breech delivery. Diagnosis and test for the septate uterus. There is a diagnosis, that is with the complete medical history and physical examination. In that, a pelvic examination is very important. Some additional tests, that is ultrasonography or MRI, to create a picture of the uterus and to look for other abnormalities. Treatments and the care when necessary. The surgery, it can be performed to remove the wall of the tissues. Okay, so if necessary, then only the surgery is done. Okay, so that is about the septate uterus. Next, that is a bicornuate uterus. Okay, bicornuate. Remember all the terminologies with the definition itself, or the term itself can give the ideas about the whole condition. Bi means two, and cornua. What is cornua? Anyone remember? Then the fallopian tubes. Where the fallopian tubes, they joint with the fundus or with the uterus. This part is known as the cornua. Okay. So here there is a two division of the this cornua, and that is known as the bicornuate uterus. Okay. The shape here, it is like the heart shape. Okay. In the septate, there is no any changes in the shape, but there is a one division or section is formed. In the bicornuate, this condition, it deals with a heart-shaped uterus with two horns. Means there are two horns is there, and they are with the heart shape. It could increase the risk of the preterm labor. Okay. This is a normal uterus diagram, and this is a diagram of the bicornuate uterus. Okay. A bicornuate uterus, it's a type of the congenital uterine malformation, and that is a Mullerian duct anomalies. Okay, there is a fusion of the Mullerian ducts, and in the bicornuate uterus, it is not properly fused. So, in these conditions, the uterus, it appears to be a heart-shaped organ. Symptoms of bicornuate uterus, that is irregular vaginal bleeding is there, repeated history of miscarriage, painful menstruation, abdominal discomforts, and pain at the time of the intercourse. Okay, the symptoms of any or all congenital abnormalities that are same, or they are from that we have discussed in the common signs and symptoms of the anomalies. Okay, so irregular vaginal bleeding, history of miscarriage, painful menstruation, abdominal pain and pelvic pain, and pain at the time of the intercourse. Next, if the woman they conceive a pregnancy with the bicornuate uterus, then what happens? A bicornuate uterus, it raises the risk of having a miscarriage and later in pregnancy and deliver the baby earlier. Okay, that is same like miscarriage and abortion or preterm birth. If women have a bicornuate uterus, the pregnancy will be treated as a high risk pregnancy. Okay. High risk pregnancy, then what is a high risk pregnancy? A high risk pregnancy, it's a condition in which the pregnancy is complicated to mother and baby both. Okay. Or there are some serious effects, there are chances of some serious effects or some bad effects to a health of the mothers and babies. The baby may settle in a breech position. Okay. Now remember the breech, the baby's legs will come first at the time of delivery, which means their bottom or feet, they are facing down before the birth. Okay. Normally what comes, there is a head. Okay. And in the breech, bottom or feet, they are come for the delivery. They may require extra testing and will be more likely to give a birth via a cesarean section or cesarean delivery, that is operative. So with the patients biconvulate uterus, if they have conceived the pregnancy, delivery is done by the cesarean section. How we can diagnose? That is the same ultrasounds, MRI. Here one additional, that is hysterosalpingogram. Salpings, if anyone remember, then it is salpings means that is related to the fallopian tubes. Okay, so that is a complete examination of the fallopian tubes. And last, that is the pelvic examination. Treatment. The surgery that is called a Strassmann metroplasty. It can sometimes be used to correct a biconvulate uterus in the woman with the history of the miscarriage. So under this surgery, the metroplasty is also known as the Strassmann metroplasty, that is a uteroplasty or hysteroplasty. That is a reconstructive surgery which is used to repair the congenital anomalies of the uterus. This surgery is used for not only the biconvulate uterus, but it is also used for this we discussed earlier, that is a septate uterus. So both they are treated by the Strassmann metroplasty. Next, okay, so two we have covered till now, that is a biconvulate uterus and septate uterus. Next, that is arcuate uterus. Arcuate uterus is a condition in which the uterine surface has a slight indentation, and this condition isn't highly associated with the loss of the pregnancy. Okay? Means the indentation means surfaces. The surfaces they are like the concave or counter towards the fundus. Okay, I will show you the diagram here. In the normal uterus, if you had remember, then this is like here dome like structure is there, and in the arcuate uterus this structure is become very concave. Okay. The arcuate uterus is a form of uterine anomaly or variation where the uterine cavity it displays a concave counter towards the fundus. Okay, diagram is must be clear. Okay. Okay. Now here how the arcuate uterus will be formed. Okay. So this is a normal uterus. Okay. The fundus is like this. Then under the mild arcuate, it is like this. If moderate, it is like this, and severe, it is like this. And if it is too severe, then there are chances of developments of the bicornuate uterus. Okay. So that is about the arcuate uterus diagram. Next, unicornuate uterus. Uni means only one. Okay. So a unicornuate uterus is described as a uterus that is only half development. Means as you know or remember the diagram, there are two separate or two different developments of the diagram, right and left both are same. But under the unicornuate, it is only halfly developed. A unicornuate uterus is a genetic condition that causes only half of the uterus to form. As a result, there will be a single fallopian tube instead of two, and the uterus that is usually smaller in the size. And this all sounds pretty noticeable, but often don't find out about it until the women start trying to conceive the pregnancy and they are having the difficulty in getting the pregnancy. Okay. Unicorn with uterus, under that only the uterus is only halfly developed. It is a genetic conditions in which the half uterus has been formed, and under the yonic conduit only one fallopian tube has been developed instead of the two, and the size will be smaller. Okay, until the women they are trying to conceive the pregnancy, the women they are not able to identify the condition of the unicornuate uterus. Okay, here the diagram is shown. Okay, this is only one part of the uterus has been developed. Next, if the women they have conceived a pregnancy with the unicornuate uterus, then the complications arises, that is a breech pregnancy or breech delivery. Under that, the baby's bottom part has come for the delivery. Next, increased risk for the cesarean section. Means they are not able to deliver or there are difficulties with the delivery under the normal. Increased risk for placenta previa and abruption placenta. Okay, a placenta previa, that is a placenta, that is one structure that is providing nourishment to a baby inside the uterus. Okay, and the placenta that is situated in the upper part of the body of the uterus. Okay, and a placenta that is separated after the delivery of the baby, means the baby is delivered, after that there is a separation of the placenta and the delivery of the placenta is there. Okay, so here what is a placenta previa? That is placenta is partially or completely implanted inside the lower uterine segment. And second term, that is a abruptio placenta, that is a early separation of the placenta, that is before the birth of the baby or before the actual labor. Okay, these two are comes under the antepartum hemorrhage. Next, that is IUGR, that is intrauterine growth restriction, preterm birth, birth before 37 completed weeks, and preterm premature rupture of the membrane. In short, that is known as PROM. Okay, at the time of delivery, there is a rupture of the membrane is there, and a pregnancy with unicornuate uterus, it has been ruptured earlier. So a unicornuate uterus, the uterus is in the one horn or only one side has been developed. Next, that is a Didelphys uterus. Okay, this condition occurs when the woman has two uterine bodies. Each uterus has a cervix. Means uterus didelphys, it's sometimes known as the uterus didelphys. It represents the uterine malformation where the uterus is present as a paired organ. Means there are two uteruses are there. When the embryogenetic fusion of the Mullerian ducts they fails to occur. Okay, so this is due to the failure of the Mullerian duct fusion, developments will be there. As a result, under the didelphys uterus, there will be a two separate uterus, two separate cervix, and two separate vagina will be there. Each uterus has a single horn that are linked to the fallopian tubes and that faces the ovary. Okay, this is a diagram of the didelphys uterus. Here you can see that there are two cervix, two vaginas, and each side there is one fallopian tubes and they are connected with the ovaries. Symptoms under the didelphys uterus. Patients with uterine didelphys may not know it. Means the patients they are asymptomatic, but the treatment could be needed if the symptoms occur such as unusual pressure or cramp-like pain before or during a menstruation, and abnormally high amounts of bleeding during a menstrual period, and repeated history of miscarriage and preterm labor. The treatment. It is rare for a patient with a double uterus to go through a surgery to unite a uterus, but surgery may help a patient to sustain a pregnancy if she has a partial division within her uterus and no other medical explanation for the previous pregnancy loss. So surgery can be done to repair the wall of the uterus. So that's all about the congenital anomalies of the uterus. First, that is a septate uterus, that is a partial and completely septate. The diagram, this is a partial septate and this is a complete septate uterus. Symptoms, that is clear. Second one, biconvate. It is a heart-shaped uterus with two different horns. Next, arcuate uterus, that is a concave counter shape towards the fundus. This is a concave counter shape. Next, normal, mild arcuate, moderate, severely arcuate, and lastly, biconvate uterus. Uniconvate, only half development will be there. Okay? Only half uterine development is there. And last, Didelphys uterus. There are two separate uterus are there with two separate cervix and two separate vagina. They are connected with one fallopian tube and the ovary. Okay, so that is all about the uterine anomalies. Thank you.